Good day. My name is Jan Clifton-Gaw, and on behalf of my fellow presenters, we would like to welcome you to a current practice skills for AT clinicians bridging the web of care seminar related to airway management and O2 supplementation for ATs. Today, we know that all athletic trainers are required to have their basic airway management skills that are often received from the American Red Cross or the American Heart Association in their biannual training. Those typically involve a simple mask that we use. The key is making sure that we have the right equipment available to complete this process. We have this skill set already, but we need to go and deal with additional information. We are all taught in our educational programming to become certified athletic trainers how to remove equipment such as a football helmet or a lacrosse helmet or an ice hockey helmet to engage the airway. We know how to do that, but what you need to remember is to have the least common denominator material with you. It's great to have a trainer's angel or an FMT extractor. We can get into a lot of things without having to remove the helmet, but sometimes you need the least common denominator because you never know what the equipment's going to be. So making sure we're prepared and thinking about this process before we have to activate actual airway skills is important. We know how to engage the EMS. That's not a problem either. We know how to rescue breathe with and without a bag. We know how to do CPR. But what we need to address is the skill set of supplying supplemental O2 because many of us have not been trained in that. I'm going to lead my time to Mr. Chris Gleason.
Oxygen administration can be downright intimidating. 2,000 pounds of pressure, pressure regulators, all that tubing. I mean, look at this thing. It looks like a rocket. Understanding what to do with this piece of equipment can be a vital tool for stabilizing your patient with respiratory distress. Another key factor in the decision making is a pulse oximeter reading. If the pulse oximeter reading drops below 94, the patient is a likely candidate to receive oxygen. There are going to be three methods that we discuss of delivering oxygen to the patients: the nasal cannula, the simple face mask, and the non-rebreather mask.
It's always a good idea to clear the oxygen tank. We do this by taking the key or wrench and quickly cracking open the valve. Next is the installation of the regulator to the tank. There may be some fear that this will be installed incorrectly. Rest assured, the design with the two teeth on the regulator, as seen in this photograph, matches the two holes on the tank. Now let's familiarize ourselves with the regulator. First is the gauge. This is the indicator of how much oxygen is left in the tank. 2000 psi is a full tank. Next is the flow rate indicator. This is how we control the oxygen flow to the patient. Be sure the flow is on before delivery to the patient occurs. Finally is the oxygen outlet barb. This is where the connection of the device you wish to deliver oxygen to the patient is connected to the regulator. Ensure a tight fit with no leaks. It's good practice to do periodic checks on your oxygen equipment.
First, the nasal cannula. Something to remember when we deliver oxygen through a nasal cannula is this person is conscious. They're able to breathe on their own power. Their oxygen level has just dropped below that 94 mark. So they're not breathing through their mouth, they're breathing through their nose. And we're going to just assist that process. They need a small amount of oxygen. So remember, when we're talking nasal cannula, 5. The rate here is 1 to 5 liters per minute. Next is the simple face mask. This one is useful if the patient is a mouth breather at this point. They're not able to breathe through their nose on their own. They're still conscious, but they just need a little bit more assistance. When you think simple mask, think 10. The range is from 5 to 10. This is one of the most effective ways to quickly increase the oxygen to the patient. It has a reservoir on the bottom that increases the concentration of oxygen inhaled by the patient. Since this one is the highest, remember 15. The range here is 10 to 15 liters per minute. Generally, patients who are conscious, breathing under their own power, are given oxygen. However, oxygen can be connected to a bag valve mask to increase the oxygen level while administering CPR. Some takeaways. Nasal cannula, 5. Simple face mask, 10. Non-rebreather mask, 15. Remember this, if the administration of oxygen is necessary, so is the constant reassessment of your patient. Remember, watch their level of consciousness, their oxygen reading on their pulse oximeter, the color in their skin or mucous membranes, their breathing rate, and their breathing depth. If these return within normal limits, that pulse oximeter goes above 94, then we can remove them from oxygen, but monitor. If they don't in a timely manner, then that becomes an emergent situation and EMS must be activated.
Again, on behalf of my fellow group members with the DAT program today, we really want to thank you for taking the time for this Bridging the Web of Care, advancing our skill sets, no matter where we are in our professional career. Thanks. Don't be afraid. Continue to learn. Have a great day.